Structure for the digital age. It's a very beautiful session now. This session is chaired by Dr. Sushil Kumar Mayer, Head IT, All India Institute of Medical Science, Delhi. May I request Dr. Mayer to please come on the stage. Ladies and gentlemen, give him a big hand. And we have very distinguished panelists in this session. Dr. Amitabh Yaduvanshi, the coordinator and head of cardiology, Holy Family Hospital. Dr. Saab, please join us. Mr. Prashant Obrai, Director India SAC, Norden Communications. May I request Prashant to join? Prashant from Norden. Dr. Amit Swarup, Head Business Development, Stemz Healthcare. May I request Dr. Amit, please join us. Mr. Sharat Anand, Jupali Managing Director, Shivam Microsoft. Shivam Medisoft. Sharat from Shivam. Yeah, Sharat, please join us. Then Ronak Pradhan, Product Lead, National Health Authority of India. Ranjit, can we get Dr. Ronak? Dr. Ronak from National Health. Dr. Ronak from National Health, please. Prashant, please join. Dr. Ronak, yeah, please. So once again, ladies and gentlemen, this is the session. Smart Hospitals Transforming Healthcare Infrastructure for the Digital Age. Sir, Dr. Sushil, over to you. Thank you.
Yeah. Thank you, the organizer. You have already been defined a wonderful sessions. And it is really this session will be give a more light to the how the technology leverage to the healthcare to give a quality of healthcare. Now technology is not an issue. Issue is there how to apply the technology in healthcare. That is a more challenging. Anything you will ask, you will get the technology, but you have to get a player to integrate the technology. It is a big challenge. I understand after the lunch, it will be a difficult session for us because each and every people, they feel definitely a little bit dodgy and they lose their concentration, I think so. Yeah. Anyway, I request everyone will try our level best to give a good quality of session to you. Definitely the takeaway will be rememberable for you. See, I am working in the AIMS last 32 years. I have seen the whole digital transformation of the institute as well as in the country or government, how they have leveraged to define the technology. And today's days, we are talking about IoTs and IoMT devices. How the hospital will be smarter? How? What is smart? What do you mean by smart? Smart means without knowing everything is available to you. Whatever you want, it is available to you. Is it possible? Yes, it is possible. The smartness of the hospital starts from at the time of constructions. The major problems in the country is that do not take care of that things. When you are planning your hospitals from your drawing table, there you should start that what type of smartness is required of this hospital. If we talk about my aims, the old buildings does not support to make whole the hospital Wi-Fi. How to make that area with 5G enabled? This is the only campus in the country. It is fully 5G enabled institute. Both Airtel and the Jio has already been installed their devices there. Fully 5G enabled Wi-Fi. But my infrastructure, the building is not permitting me to do all these things. Anyway, smart in one example I am giving to you. We are talking about hospital means patient care. It means how to make hospital smart so that patient will get a quality of care without any hassle. Just one example I am giving you about AIMS. We get around 14,000 patient, OPD patient in a day. And every patient, they come with their own attendants, 1 or 2 people. So 50,000 nearly will get in the OPD in the morning. I have to manage these 50 people, 50,000 peoples. These 50,000 people, how they will come to the hospital? First, you have to talk in that level. They will come by Ola, Uber, autos, own car, or metros, and by walking. How to manage this crowd? When you land up in your Ola and there is a lot of traffic inside the AIMS, is the buildings, roads are compliant? You have to look into that angle. When 50,000 patients are coming, my road should be like that. When they'll come down from the car, that much of space supposed to be there. None of the hospitals, I have seen major hospitals in the country, none of the hospital is compliant on that. कहीं ट्रैफिक सॉरी कहीं आपको पार्किंग नहीं मिलेगा, पार्किंग मिलेगा व्हील चेयर नहीं मिलेगा, आपको स्ट्रेचर चाहिए स्ट्रेचर नहीं मिलेगा. If you do the digitization, what is the use of that? When patient is landing, he does not have that kind of support. I have a trauma care. It is fully supported by, from the design level it is supported to how to care the technology. When the ambulance will come up, it will go to the RAM and remotely it will connect it to the hospitals, AIMS Trauma Center, that this patient has this kind of problems, get ready for it, and stretcher is ready when it will reach. Time is very precious. You will search wheelchair or stretchers, then it is gone. Second part is I am talking about in the OPD. Let's take, I am a patient. I have to go to the AIMS to show something. What I have to show? You have to show to a doctor. You have to meet a doctor. First of all, you have to take an appointment. It is online. It is totally online. 30% the OPD quota is online. 30% on site. 30% revisit. 10% emergency and other cases. Total 100%. These 30%, they have to take the appointments. Right now, we want to start, 2 things are there. You can book your parking, you can book your stretcher or your wheelchair. You can book your slot. When you take the appointments, there will be a voice bot as well as online charting. It is AI based. Because 32% they landed in a wrong department in the appointment. It has been reduced to 10% because after using this bot. This is called smartness. So one patient when will come, if he's coming for Ola, particular 10 o'clock, he has the appointments, his parking is allotted, he has got the wheelchair, he has got the, which doctor has to be seen. And one thing I'm talking about it, nobody has, I think so, done in the country. In the OPD, it is not required to go to any counter. You can do yourself registration or from your mobile. In the OPD hall, we have the QR code. It is pasted. Scan that QR code. Then it will ask, do you have the appointment? Then you have to write the appointment number. Then all the details will come up. Do you have ABHA ID? No. Yes or no? If it is no, then he'll ask, what is your Aadhaar number? Then it will generate the Aadhaar ID automatically from your mobile. It will generate your registration number from your mobile, and it will allocate the room number and doctors. Not that it is. If the queue number is, let's take 8, to see the 7 patient by the doctor, it takes 1 hour. Then it will tell you, it will inform you that be in your doctor's room before this time. Let's take 45 minutes is the waiting times. These 45 minutes you can go here and there or go to the canteen to have a cup of tea. This is a technology you can leverage it and give to the patients if you are very serious about it. Today, I'll talk about what is the IoTs, how IoT is embedded in medicine, that is IOMT. And in the one video, I'll show you how we have made the smart lab. The pre-analytic, analytic, and post-analytic all are automated and used by robotic hands. All the samples will be handled by the robotic hands. That video I'll show you. This is the one of the high-tech medical labs which we have already in AIIMS New Delhi. Thank you. I have many panels. Everybody, I think so, you have the presentation?
We have a presentation.
Okay. So what we will do it, let me give my presentations. It is just very introductory. After that, you give your presentation. Each presentations, we have some questions. So that will be connect to the people and give more practical use. Because medicine is a practical. Without practical, it's not possible. So make it very simple, practical, but technology is supposed to be there. So this is my request to all the speakers. Okay, thank you. Hello. IOMT is a very simple critical device. 10 years ago, when I have talked about the IoT device, at that time it is a research format. At that time, I did not find any vendors to give a solution on IoT device. There's some research was going on in the IITs and other medical colleges, but not in there. Then we have started to do something, how to use the IoT device in healthcare. First, we have tested. And we can't believe it, there is one open source device which was available. It is called Raspberry Pi. Anybody heard about Raspberry Pi? Yeah. Raspberry Pi. We have purchased from Amazon in 1200 rupees, and we have tested in our TV. At that time, the two types of TVs were other. It was coming in the market. One is a smart TV, another one is normal TV. So we have used Raspberry Pi to make the smart TV. And at that time, the normal TV and the smart TV, the price was around 20 to 25,000 rupees difference. And we have successfully we have integrated and we have made the TV smart. Then we have started, why not it will integrate to our medical device? So when the patient is coming, he has to take in the weight, then enter in the computers, height, again and take the heights and enter to the computers, take the BP, again enter to the systems. There may be some typing errors, or there may be some glitches to take the system to that place. So what we have done it, we have used this IoT device, the Raspberry Pi, to integrate this one, and it is connected with our network, intranet, and transfer the data, the weight, height, weight, and all the BPs to the systems. This is more accurate and online. When you reach the doctors, all the things are available to his desktop. So this is the first we have got the success in-house. It is, and today days, you can't believe it, in IoT device, if you'll see, only what I know, only one vendor is doing it to integrate all the labs, lab equipments. Just I'm giving the, refreshing you, that this is a technology which is, we have seen in the past, and now we are in 20th century, 21st century, and the IT and communications plays a major roles. That's why we all people are here. Without internet, the life is totally a normal, you will not think as a normal life. Internet's playing a major role for us. And through internet, we have to do each and every activities. So that's why this IoT device plays a major roles in the healthcare today's days. These are the technologies coming up in the healthcare. The IoTs, blockchain, AI, AR and VR, and another one is the high-tech cybersecurity. See, in medical science, how it is emerging and how it is coming up, you see it. In the 21st century, it is the information communication technology in the healthcare management. So many people, they have their own apps. Even you see, right now, mobile technology is totally absolute. What they are putting into the technology? They are giving the good processor, high amount of storage, and the new things is coming up, that is healthcare product inside the mobile. So you might have seen it. Most of the mobiles you will find, it will give your temperature, it will give your beats, means heartbeats rates, it will give your how much step you have gone, how much calorie you have lost. This sort of things you will get it. In future, definitely we are coming with the, what is the ECG will be in the mobile. So in this era, e-health is playing a major role for us. Electronic health is playing a major role for us. It includes the networking within the medical informations, health records, telemedicine services, wearables products, already it is there, and portable monitoring system which is remotely controlled. These are the things already been placed. This is the synergy of e-health. We are talking about the population's health care, that is public health informatics. Another is the medical informatics. Another one is your medical imaging. Another one is your bioinformatics. This session is 1.5 hours. I am taking a little time, yeah. So everybody will get the time also. But you will make the things very interesting. I do not have much slide. Just I am giving a inside of the systems. Now we come to, this is the one slide which is important for you. That the core area is mobile patient monitoring. And it has been accepted during 2020, after 2020, because of the COVID. Earlier, I was trying to implement telehealth or remote health care since 1999. Neither doctors nor patient is ready to accept it. After the COVID, it has gone in such a high, you can't believe it. So why you need? The lifestyle is one of the big issues in the healthcare. That's why people want that. Why not the health systems, health products supposed to be available in the mobile? So whenever it is required, I can go through it. So these are the e-health system available in the different users, different perspective. These are the technology which has to be integrated with the IoMT device. All the modalities supposed to be available, and it is supposed to be integrated, and it is communicable. Because any information, people do not want to be within the four wall of the rooms. It's supposed to be exposed to everywhere those who are rights to access the information. And today's people are looking towards one thing, that is personalized healthcare services. My health is different than anybody's health. That's why we have molecular engineering, we have sequencing, and in other fields we have a big data analytics. So for this, next generation healthcare is 4P. It is how to predict what disease we can predict ourselves, what kind of things we can prevent it. Another one is how it can be personalized. And third one is that all the people supposed to be participated. The 4P concept right now internationally, people are looking towards it. For this, you need data. And one simple statement I'm talking about, more data, more healthcare. Less data, less healthcare. So data when will be generated? It will generate from you only, your device only. So in the personalized healthcare, how we can detect early so that you can prevent that disease to go up. So you have to use the technology.
1 minute, sir. Every speaker has
Okay. So this is the things. These are the 4Ps concept, how it is integrated. So this is the meaning of IoMT. IoMT means the Internet of medical things, which is mean the medical device will be integrated with the internet protocols to your database. So in IoMT, the health monitoring systems, people are looking towards it. Data analysis and integration of healthcare systems. The three components it is required when you go for any IoMT device. These are the examples, definition already I have spoken to you because already they have told me that you have a limited of another 3 to 4 minutes. Here is some common type of IoMT device. Fitness wearables, already people are using it. It is integrated with their mobile. Clinical grade wearables also it is there. Right now, remote ICUs are there. It is already been integrated at the homes, and remotely doctors, they are monitoring it. Remote patient monitoring systems, it is another part of that. Smart pills, patient care device and kiosks, medical monitoring systems, and hospital devices. It is been integrated with the IoMT devices. One laboratory equipment is there, how it will be integrated with your database. And you test the labs, your samples, your blood sample is tested. This is generating the reports. It will transfer to the database. How it will be? It needs some device. And that devices, it may be a one-way communications or it may be a two-way communications. So these devices can be integrated with the IoMT devices. And already I have told you, I know only one vendor in the country who is providing this. It is not a rocket science. People can start up with these devices because majority of the devices is required some connectivity. Right now what people are doing it, this is another communications. we are communicating now with two things. The equipments, medical equipments, it is integrated with another language, it is called HL7 messaging. Right now, people are using also starter fire also, but HL7 messages through, it can be integrated through your IoT devices. If we put a servers in between, it takes lot of space and limited number of devices can be connected. But IoT devices just, it is the size of your mobile. Your mobile size is almost same size of IoT device. So this is the diagrams, it is connected with the machines and transfer the data when the test will be performed by the medical equipments. These are the workflow which is being used in the laboratories, and we have already more than 150 machines. Okay, just a minute. 150 machines which has been connected each other. Anyway, I have got some. I'm showing one video to you. Then I'll end my. You'll see how the technology is leveraging in the lab reporting. Your mouse is not working. Okay. Play. This is the smart lab. There is two labs we have. We have the robotic labs and another is a smart lab.
Laboratory testing is a crucial step in the diagnosis of medical conditions. It helps in planning and evaluation of treatments and monitoring disease stages. For these purposes, an accurate and authentic laboratory report is essential. Various laboratories and AIIMS worked tirelessly in this regard, but they were scattered and doing a limited number of tests. Patients had to run to different labs and undergo the same procedure everywhere. That led to delays in the test results and ultimately a delay in diagnosis and treatment of the patient. Smart Lab, a unit of the Department of Laboratory Medicine, is a major breakthrough in this direction. This lab was inaugurated on the 19th of May 2020 with a capacity of 8,000 tests per hour and 1.5 to 1.6 lakh analytes per day. This fully automated advanced lab is an umbrella facility for hematology, coagulation, biochemistry, and immunology tests. At present, Smart Lab is functioning round the clock, receiving on average 4,000 to 4,500 samples per day, approximately 60,000 analytes in a day, and reports are dispatched digitally on the same day. Patient samples are received from different outpatient departments, and barcoded samples are received from wards. Sorted and barcoded vials are then scanned for further processing. After scanning, the samples for biochemistry and immunology assays are loaded in the automated centrifugation unit. Centrifugation is done at various speeds for appropriate tubes. Then, centrifuge samples are transported
This is a
to
robotic
decapping
hands.
module,
How it
which
is
will decap the tubes
been used
and
here.
then passed on to the sorting unit Cobas P612. Robotic sorter will transport samples by a track system which is interconnected to all analyzers in the lab. All the sample results are finally verified by resident doctors in the Infinity software. After successful verification, the sample results are transmitted to Hospital Information System provided by NIC. For hematology, we have the fully automated analyzer.
Thank you. This is the fully automated, and the reporting will be done in the AI-based analytic So only 10% of the reports it will be verified by the doctors. Other one is totally by the analytic AI programs, they're reporting it. Thank you. Anyway, just my introduction, it was IOMT. My other panel members, Mr. Amitabh, yeah, can I have your presentations? And we can discuss after that, yeah.
Good afternoon, everybody, and thank you, Bharat Exhibitions, for allowing me to talk in this conference, and thank you, Dr. Meher, for an excellent talk, which made my job a little bit easier. So the topic given to me is Internet of Medical Things, Empowering Healthcare with IoT and 5G. So let me first introduce myself. I am a medical doctor, and I am not at all in league with the IT professionals that are there in this forum. So my only claim to fame is that I might consider myself as a technology enthusiast, and I was probably the first one to have a digital camera way back in 1990s during my school and college times. I had a pen drive. I was the first one to use the pen drive in my college. It was a 64 MB pen drive. Then I still keep on collecting a lot of gadgets. Most of them are now stacked in my storeroom. I don't have time to use it, but then that's how it is. As far as the technology part is concerned, I did self-taught myself, and I did develop a app which we are using at Holy Family Hospital to track the referrals that are given to us through the various departments, through the cardiology department. So we are able to track these referrals, we are able to store them, and we are able to kind of analyze the turnaround time. So that much is my technology thing. So forgive me if my talk looks like a little pedestrian and simple to you, but that's my limitation of my technology knowledge. So we all know that 5G, the spectrum of the Gs have increased from 1G, which was good for analog voices, then 2G, which was good for digital voices, 3G was good for mobile broadband, 4G was faster and better than 3G, and now 5G is a land of hyperconnectivity, where interconnected devices, sensors and system can talk to each other with very fast speeds. And global adoption of 5G has been improving, and it is fortunately also very well adopted in our country. So as far as 5G is concerned, the important aspect is the capacity. It is very high capacity, 100 Mbps whenever needed, and more than 10 Gbps peak data rate can be achieved. So more than 1,000 times more traffic can go through 5G. It has a latency of less than 1 milliseconds. It is ultra reliable, and many more devices can be connected. So that's the advantage of 5G over the other technologies. So as far as 5G is concerned, these things like augmented reality, tactile internet, virtual reality, or autonomous driving, all these things can be possible only through 5G technology, because you can have person to person, person to machine, and machine to machine interaction with this. So as far as health is concerned, if you talk about telemedicine, the high bandwidth that is provided with 5G allows us to do teleradiology, telepathology, teledermatology. So in fact, in teleradiology, we have cardiac MRIs that are done in our hospital, but we are able to get it reported from a person who is situated in Netherlands, because he's an expert in cardiac MRI. So we always get an expert opinion from a person who is so far away. Telepathology, dermatology can also be done. The fact that 5G provides with a very low latency that allows us for things like remote monitoring, real-time interactive processing, and remote surgery You must have heard that people are doing remote surgeries. In fact, in India also, people in Gujarat, people have done remote angioplasties where an operator sitting 800 kilometers away from the patient was able to do a robotic angioplasty. Although it sounds fantastic, but then it is a time when it will no longer be fantastic. The adoption of 5G is also increasing, so remote monitoring is primarily the biggest chunk of utilization. Virtual consultations, which has also increased, especially after COVID, and connected ambulances and other things are also possible through 5G technology. Talking about Internet of Things, as Sir said earlier, it is basically what it enables is any device can talk to any device. So human interaction may not be required. So a device can talk to another device, which can then talk to a third device and give you the output. So intervention, manual intervention is decreased. So when you talk about the applications that are possible in healthcare with IOMT and 5G, they can be, as Sir mentioned, sports and fitness, remote patient monitoring, home healthcare. We can have smart watches, activity trackers, patches, and smart clothings. Then you can also have monitoring purposes like heart rate, pulse, blood pressure, glucose levels. Now CGMs are very commonly used in our country. We can have fetal heart rate monitoring, neuro monitoring, fetal heart rate. One of the system is in fact available to display here only. We also use remote monitoring for monitoring our patients who have cardiac implantable devices. Now Bluetooth enabled devices are available where the device can communicate through the patient's phone to the central server, and in case there is a immediate or concerning problem with the device or the patient, that can be immediately flagged down to us. So this is how most of the time remote monitoring is almost 32% of the apps that are available to us. Then there are diagnostic apps and then other things. So the estimated global impact of remote monitoring in 2030 is like after 5G, 4.2 million extra beds can be available, which is a 5.7% increase. 250 million extra patients can be treated through telemedicine. 35 million emergency can be better responded through connected ambulances, and this translates to 196 million extra patient treated. This is if 5G is adopted in healthcare. So the few examples how 5G or a connected IOMT can help. So one is asset inventory management. So again, as I told you, the interaction is very limited. So a technician or a nurse can just scan the whole room, and the inventory of all the devices or the things that are there can be automatically through the interaction between the various devices. You can find out what is the calibration, what is the expiry date, all these things can automatically. So it decreases a lot of time for healthcare workers, which can then be utilized for patient care. Similarly, asset utilization can also be there. So suppose you have, this is example of a defibrillator. The person is taking out the defibrillator, but the IOMT detects that this is the last defibrillator that is available in the cardiology unit. So it prevents that person from taking that defibrillator out, because cardiology unit is the unit where you might require the defibrillator more frequently. So useful asset utilization can be achieved through IOMT. Then asset safety, you can tag your assets through RFIDs, and then if suppose there is pilferage, that can be detected through the IOMT and person can be taken care of. Then more importantly is patient throughput management. So you can have smart tags that are attached to the patient, and once the patient goes from one place to another, so suppose this patient is going for a surgery, then the technician, the people who are transferring the patient knows where the patient needs to be sent. The visitor is able to see what is the real-time tracking of their patient. So they are also comfortably seated in the waiting area, knowing that, okay, the patient is now in the pre-op, now the patient is sent to the right OT. So suppose you go to the wrong OT, it will give you an alarm. Once the patient is in OT, the attendants knows that the surgery has started, and once the surgery is over, they know that the patient is there back into the recovery room. So all this is totally automated. No manual interaction is required. It is all through the intertalk between the devices that are there, which can show you these things. Patient safety, another important. The same tag can be used to alert a nursing station. The nursing station will get the call. She will respond. She will see what is the requirement. Suppose an ECG machine is required. There are only limited ECG machines in the hospital. You can identify where the ECG machine is placed. The person can then straight away take the ECG machine, get the ECG done, and effortlessly and within a reasonable amount of time can take care of the patient. Infant safety, another aspect where you can have a tag, and similarly, it's like geofencing that you use. So the tag is then fenced to the room. So if the tag is removed, if the tag moves out of the room, it is alerted, and the security can be alerted. Staff safety, another aspect. If there is a violent patient, the doctor can or the staff can activate the emergency alarms, and the person can be taken care of. Another important thing is location-aware work demand management. So if you have a requirement of suppose a GDA on a particular floor, the location of the GDA is available to the central monitor. The person can be asked, the nearest person that is there can be asked to take care of the required thing, and all these are automated processes and feedbacks are there which can tell you whether the thing has been done or not. Similarly, environmental monitoring. There are certain critical areas where a certain amount of humidity or certain amount of temperature is required. That all can also be monitored through this IOMT device. So with an IOMT device, you can have a healthcare which is operationally aware. So all these things are available commercially, maybe not in India, but they can always be provided. As sir mentioned, these are not things that are, the technology is available, it's just we need to use it efficiently. So use cases of IOMT, advanced predictive maintenance. So before a device or before a biomedical device gets shut down, you can have preventive maintenance. Remote patient monitoring, already mentioned. Augmented reality, you can do surgeries, you can do dermatology through augmented reality. High definition virtual consultation is possible. Connected ambulances, as sir mentioned, as soon as the ambulance lands into the trauma center, the whole system is activated. Then inventory management, as I already mentioned. So with the advent of 5G, all these things have become more efficient, more reliable, and with less latency. So to end, a healthy society makes for a healthy world, and thus a better future comes with 5G-enabled smart healthcare. 5G brings latency low enough to provide real-time information, either to deliver live HD videos to a paramedic or to even enable remote surgery. High bandwidth enables doctor to keep in contact with patients or the elderly, or to transmit and analyze large data files. So a large MRI data or large angioplasty data can be transmitted very easily. Reliable and security enhanced communication within the hospital, and thus 5G technology is said to have a transformative impact on the healthcare. Thank you.
Thank you, Dr. Amitabh. There are two things he has spoken to you. One thing is the tagging. It is really an essential technology today's stage. People have started now geotagging also, but it is very expensive. But in the medical equipment, tagging is much more required, because when you need a ECG message immediately, where it is not available, and patient is waiting for it, and doctor is waiting for it to how to get the treatments, because without ECG they can't give any intervention on this. This is the technology, we have to leverage it. Can you share something, if you have any such kind of wonderful experience in your hospitals?
practical experience in the hospitals is not yet available, but these technologies are available. The only thing, we use remote monitoring very frequently, and we have devices now, implantable devices. We have an ILR which can monitor. So suppose sometimes some patients have very infrequent arrhythmias. Patient just fall down, so but these falls are maybe once in a month or 3 times in a month. Then Holter recording is not really possible, because when the patient is having a 24 hours or 7-day Holter, at that point of time the patient may not have the symptoms. So now we have technology where we implant a device, ILR, and that can record up to 2 years. And through the Bluetooth mobile, in case there is a arrhythmia, that can be done. So all these things are there. As far as you said, now Holy Family is coming up with a new building, and hopefully, as you said, as soon as it starts from the time the hospital is constructed, because it has to be constructed in a way where all these technologies can be enabled. So hopefully that is something that we are taking in mind, and it's a futuristic thought process.
Yeah, that's why when we talk about smart hospitals, there is one software, it is called BMS, building management software. It can take care of your fire, you can take care of your air conditioning, you take care of your pollution levels, it can take care of your moisture levels, what it is there. So these sort of things, it is a part of the smart hospitals, and it has to be built up at the time of constructions or the time of designings. Okay, thank you. Next, Mr. Prashant, you can have your presentation.
Good afternoon, everyone. First of all, I would say we have been talking about this particular thing. I am no health expert, but when people have been talking about smart hospitals and smart infrastructure, and as Sushil sir said, we have to start from the time of the construction. And a lot of examples were given by Dr. Amitabh. So I would come from the IT background and present that. See, everything, whatever these people have talked is from a medical background, and they have been talking about IOMTs, which are basically the interconnected devices. Finally, those interconnected devices are getting connected to somewhere at the base in the hospital. Even though they are interconnected to each other, but finally the data has to reach the doctor and interconnected, which means we are consuming that kind of bandwidth. We are talking that kind of infrastructure which can handle these number of devices, which can process. The infrastructure should be able to process that kind of data which is being available. So we have to start right from the building stage. And that's what I'm talking from the product background on the IT side, nothing to do with health in terms of the medical terms of health. But yes, within that IT in terms of what it could create a smart hospital, and it could help in terms of infrastructure. I am from Norden Communication, which is a UK headquartered company, and we are into the ELV space, operating globally into 40 countries today, directly or through our distributors. We started nearly 2 decades back, and we have global footprint present into the ELV space. However, in India, there are certain limited things which we are doing, primarily on the infrastructure side. When I say IT infrastructure side, the surveillance and public addressal system. See, one is, and I would like to relate all these things to whatever 2 esteemed panelists have spoken before me, because when he talked about even the number of patients visiting the hospital, whether we have roads available or not, whether we are talking about, let's say, even when he says Jio and Airtel have already enabled the hospital with 5G, but the building because of the limitation of the building, he cannot reach it to every place. Let's say the building also, the new building can have that 5G infrastructure, but finally there would be base stations, and those base stations should have those kind of infrastructure. Or like one example which Dr. Mitab gave of a violent patient. Just I'm giving that particular example, or it could be the other side of the example where a non-medical staff or a security staff, there is an issue and he misbehaves. Now, we don't know which side is right at that point of time. What do we do about it? Though these kind of infrastructure elements which could help to avoid this, because a lot of things, whatever I wanted to say, have been put in perspective by both of them in a different way in terms of medical side, but like right from the infrastructure when we are building, right from covering the perimeter to even integrating solutions which are like entry and exit in terms of the car entering with the number. This could be not only for the security reason, this could be automated for the parking reason. We could automate with the number plate itself. We don't have to have manual parking. We can integrate it with now smart tag, fast tags available. You can integrate the technology, eliminating the involvement of the people. Then we can have the perimeter security, and then when we are talking about telemedicine and trauma centers and connected ambulances, there could be in-vehicle based surveillance which could be directly connected to the hospital, and where it may not be a very senior staff available in the ambulance, but that nursing staff or whatever can get instructions from the doctor available at the base, and they could tell them what could be the preventive things they can do while the person is on the way to the trauma center. So those kind of vehicle-based surveillance solution which can be connected two ways to help reduce the fatalities, as I said again, not from the health perspective, but all these things finally can help in being a smart hospital. Similarly, as I was saying, when we were talking about the violent patient, or it could be the other side, there could be body-worn cameras which could be used, which could be later used, because then we know who was at fault and we can take corrective actions post the action also. So those kind of things. Similarly, comprehensive coverage of the each area. This is one thing which I would like to highlight, which I have been highlighting in different events, whether it is earlier at Smart City, Safe City event also I highlighted, and today also I'm highlighting this, because this is one of the most neglected part in the IT, is the cabling solution, which we see. You put any IoT device outside, you put any router outside, you put any other communication or telecommunication device outside. You can replace it if it is not performing as per your expectation. Whereas this particular physical infrastructure, when we create, physical infrastructure generally we create for at least we expect it to work for a decade, 2 decades, 3 decades. We are not talking in 1 year, 2 years, 3 years. We are talking in terms of decades. We have to be very, very careful in terms of creating, and that's where I said what Sushil sir said. We have to start right from the construction stage, because we have to be mindful of the fact what could be, what is our way forward, where we would be reaching in next 5 years, 10 years, because this infrastructure cannot be created every 3 years, 5 years, whereas all the physical infrastructure which is outside can be replaced over a period of time, whatever we want, whatever we decide. It could be as low as 1 year, or a typical life cycle of any IT product, what we call as 5 years. But this particular thing is there for at least couple of decades. So what we can do, and as we are talking about this, is I'm just scrolling through because I don't want to dwell into the product as such, because that's not the whole theme of the event is. But when we are talking about smart, so what is there, because till now even the cabling infrastructure, as whosoever would be in IT, especially Sushil sir can relate to it, we call it a passive infrastructure, right? Why should we call it a passive infrastructure when we are talking about smart hospitals? Why not have intelligent cabling being implemented now? Because when we talk about the hospital budgets versus this infrastructure, this would be probably overall only the 0.1 or even less percentage of that. even if you implement the whole intelligent solution. What it does is, when we are talking about so many interconnected devices, and today we are surrounded by IoTs, whether it is like phone or smartwatches or anything, whatever everybody is at least having 2 or 3 IoT devices currently in this room, on an average must be using in some way or the other. So when we are surrounded by all these intelligent devices all across, why the physical infrastructure be a dumb infrastructure and we call it a passive infrastructure? What it can bring you to the table is, when we make it a smart infrastructure, is you can pinpoint on that particular passive infrastructure, the so-called passive infrastructure also, as to which port has a fault. You don't need to physically find the reason whether the backbone has been cut somewhere or a port has been disconnected, how much time there is a downtime, whether it has been disconnected or cut. All those kind of reference points you can build and thereby save a lot of time, and especially in health, where we are talking about somebody's life, and when we are talking about so many interconnected devices, then for sure it can bring a lot of value on the table, because if we are able to save even one human life because of this particular thing, it is invaluable. And what we are talking about in the whole hospital, probably maybe 0.1%, I am still overestimating it. It may be even lesser than that. That is the only difference between the whole cost we are talking about, making the whole thing smart. But obviously, I cannot say you retrofit this because it is practically impossible for the infrastructure already developed, but for sure, at least for the expansions and the new infrastructure, we can look forward to these kind of things. Again, I'm not dwelling into, these are certain software features which you can get, what kind of reports which you can generate based on this for your, again, I would use so-called passive infrastructure. PA solution in healthcare, again, practical examples. I am not coming into the product, whether it is the announcement things for your medical and non-medical staffs, and your, similarly for your voice evacuation system in terms when integrated with fire alarm systems. So these are certain things. Similarly, the devices for telemedicine and all those things, these are the things. But what I wanted maximum to dwell on, which is the most neglected part, is the physical infrastructure, where we are not spending so much, which unfortunately cannot be even replaced. So we have to keep in mind where are we going and what are we heading towards, and we have to build our infrastructure which should be ready for that particular thing. I'm just scrolling through, I'm not coming to that. Though these are certain things, and we have practically most of the international certifications which are required for those products. However, in health, if there would be something more required, we are happy to do it. And with this, I would finish off. Thank you very much.
Thank you, Mr. Prashant. This is one thing what he's rightly spoken. If you'll find many times on the road, there's a lot of diggings are going on and cabling is going on. Today they have done it, you will find another 6 months or again you will find another cable is going on. So these are not properly planned. So it is rightly spoken that you have to plan early, put your passive components on place in time, so that should not be a problem. This digging, all the things will not come up. And second part is that networking is one of the biggest challenges in the healthcare, because you need a high bandwidth because you are using the high density of medical imaging within the campus. And this you know it, today's 256 slices MRI and CT is coming up. It is taken some gigabyte data. So it is a challenging way, and that's why you have to plan properly. Thank you again, once again. Next is Mr. Amit. Can I have your presentation? Yeah.
Hi. Good afternoon, everybody. So I have been listening to everybody as my esteemed Dr. Meher. Thank you very much for this opportunity. There have been a lot of information, a lot of knowledge which I have been hearing and trying to capture, and it's really overwhelming. And we are like, thank you for all the esteemed panelists for giving the knowledge. And we talk about smart hospitals, we're talking about smart hospitals, how and what smart hospitals can do, and especially through the IOMTs basically in our fields. So I'll just go through, I'm Dr. Amit basically, I'm from Stemz Healthcare. So at Stemz we provide integrated services through preventive healthcare, healthcare technology and curative healthcare through our very specialized smart clinics which are outside India. We operate from 7 different countries, and we give very specialized cares. We operate from in 3 continents, Asia, Africa and Europe, with about 8+ countries, 14 centers, 2,000 patient footfall every day, and 400 global staff across the world. We are also very happy to share that we are CAP accredited and NABL and all the other accreditations which we have. So that's a small part of about what we are and what we are talking. And I'm representing Stemz. I take care of business development. So we have been talking about hospitals, smart hospitals, future hospitals. Let's dwell 10 years back where we were and see where we are. And then I'll also like to tickle a bit where we would be in 10 years. So if you all remember, like 10 years back, everybody from healthcare industry, like lot of stalwarts here. 10 years back, it was a lot of more traditional healthcare, where a patient comes to the hospital, a doctor talks to him, prescribes, and that prescription is into a file, which takes you back. And we were very happy doing that, and I was also a part of that, so I was very happy. So there was limited automation at that time. Since the time changed, today, when we see the hospitals, healthcare, not only the hospitals, any of the different verticals of the sections of healthcare, things have evolved, things have changed. If you see now, the automation is everywhere. Like we want to automate, and we are automating everything day in, day out. Like we are having things which are doing it. We have AI which has come into the place, like which is taking a lot of attraction to these days, talking to a lot of people. We have communication systems, collaborations through various applications. We have platforms like softwares. Meir sir was talking about the laboratory part. I'll touch a little bit on that also. So diagnostics has changed, surgeries have changed, things have changed. And it's completely different. This is a shift. We never thought 10 years back that it will be like this. And similarly, we have to be ready for the future where we are going to, which would be next, like some of our esteemed panelists and the speakers were talking about the personalized medicines, personalized healthcare. So it would be coming to that, like more of the personalized cares, like I am different from other. Everybody would need to have a personalized care, and we are reaching there. So it's a precision medicine kind of a thing which will come in another 10 years, which we feel so. And when we say that things, how we are going to do that? So it's again the Internet of Things, medical devices, technologies, which will take us there, and we will for sure reach and things are there. So when we talk about these things, like when we talk about smart hospitals, like everybody, like if I talk about smart hospital, what does it mean to me? Or it to be anybody else? I personally feel it should be a care beyond the walls, because see, hospital technology takes over, and I agree to a few of my panelists, it always there, care is there, like sisters are sitting, care is one thing which cannot be like things. So it is care, it cannot be bound inside the walls of the hospital. Yes, a smart hospital will become when we take the care outside, and there are a lot of activities which is happening, we have started caring people outside also, home at health, other things, with the integrated software system. So it's care out of beyond the walls. And that is the next future. That's the smart hospitals which we are trying to build. So that's very important. Care remains the center of things, whatever we do and whatever we think. Automation is, yes, we have already started doing automation of a lot of things. And automation is, we do automation, we see a lot of automated things. We lot of devices, smart gadgets, sir was talking, Dr. Meir was talking about it, gadgets, assets, things are coming. And I feel it's coming because of the requirement and understanding of the need. So there are two things which is, so the data is flowing from everywhere, but we have to know what we need from that data. The data, and then only the technical teams, the IT, the other things can collaborate, like sir was saying about the infrastructure part, but very, very true. See, we have to think like 10 years forward from now. If I'm putting even a cable inside my building, so that cable, can that sustain 10 years from now? What futuristic things can happen and what futuristic things we can bring to the system? So that's very critical. Smart spaces, like rooms, equipment, we build infrastructure in hospitals, we make a lot of investments in hospitals. So what is the rooms, equipments with the smart technologies? How can we make it to the future? Like that is the futuristic hospital, it is smart hospital to us. Hybrid care teams, we like our sisters, nurses, technicians, doctors, everybody there, they are doing things. We have specialized, we are going to the super specialization levels, multi-specialization, but there, if we see, we can optimize things in future in the smart hospitals by having more of the multitask skill sets. So that will help us in delivering things in a better, smart way. Hyperconnectivity, we all understand. We talked about hospitals to super fast, 5G anyway is coming. And I was very happy to listen in the morning. We already started talking about 6G. Sir was talking about 6G, so that's a great thing to happen. Like we're moving pretty fast. That's very good actually. Standardizations. Standards, I am not so expert of that standards, but yes, whatever I talk and learn from people, we have made standards, and they are the global standards which are there, we are trying to get, and we have established in India, like Dr. Mihir was telling about AIMS, and all other things, Holy Family, AIMS, they are all world-class facilities which we are doing. Amitabh sir was telling that he has a specialist in Netherlands sitting, who was there, so yes. So it's a standardized things which a person can sitting in Netherlands, a person in Delhi, or in any rural area can be utilized. So that's very important. Another thing comes like flexible spaces. When we talk about infrastructure, again, sir, my thought and our thought should be like having a flexible space. We build a room with walls. We can think in futuristically, how can that walls be broken and that can be utilized some other things. So that could be a smart hospital. Optimized service lines. And at the end, everything which we do, we have to understand that whatever we're taking from this environment, we'll have to repay to it. So it has to be a little eco-friendly, and we have to reduce little carbon printing from the system. So that is very important, making systems and processes little paper-free, paperless, human intervention. So that is also our responsibility. So I think that is the concept of hospitals, smart hospitals, which we take care of from, and we think it should be the futuristic hospitals. And everybody, I think, sitting here, all the people from the healthcare industries, hospitals, all the stalwarts, they are working in some space. And sir has already spelled on different sections. I'm not going into that sections, how and what section, what everything, but I am very sure, and everybody sitting in this room is working somewhere or other on the aspects of automation, smartness, meeting the next future, meeting the things where I like to talk about little what Mihir sir started actually from the diagnostics part, sir. You showed us the future of the AIMS laboratory which is there, and I was really impressed with that. So if we again go back to the 10 years back, we see our diagnostic industry, how segmented, how scattered it was. It was like very sad. And when we divide into the analytical, pre-analytical, and post-analytical things have changed, sir. Things have changed. I have seen changing it evolve. So now, even before a blood sample, how you order a test, that is also like our IOMT and IoT comes into place. People can order their test automatically. They sit into the convenience of the room, they are ordering the test. And there are devices. I was impressed with one of the labs I visited 2 weeks back. They have moved to a scanner. They have a barcode scanner. You scan that. It will lead you to a page where you have to fill some details and some of your vitals. So it leads to you and tells you what kind of tests at this age of your time and this kind of activities which is leading to you. So that you can do at your own. You can order those tests. So that is the level of artificial intelligence and the smartness which we are going on. I know, I'll do that. I'll not take much time. So that is the intelligence which we are talking about, like diagnostics. We like sample transport. Sir showed that sample is into the track. But before tracks are also pre-analyticals. I remember sample got mismatched, sample got lost. They are smart assets, smart tags which are coming to the sample. So sample is not lost at all. So it is tracked. One hospital is a facility, but we talk about sample getting from like way from downtown, like any place in the country, like Chhattisgarh, Uttar Pradesh, and consulting a place with these smart things. So that is the power of this smartness which we are talking in the future. And ma'am also told me my time is also getting up, and I'll skip a lot of things. But yeah, the challenge, I have other the routine things, like, which is the problems. This slide I'd like to touch a little bit. This is Internet of Medical Things. We all know what IOMT, we have already been talking of IOMT. What is the four systems architecture of IOMT? How the medical, it has wearable devices, heart rate monitors, and everything. But only thing what I would like to touch on this point is, there's a lot of data. There's a lot of data. We have, and there are a lot of challenges also in the healthcare system. We need to understand what data would translate to solve what problem. That is the power of IOMTs. And then the devices, my colleagues, my startup friends, they are quite capable of manufacturing, they're changing those things. So it's very important for us to change this thing, get the data, help us go further, meet the world standards. Yeah. So I'll just skip these things, and I think that's the challenges which we have talked. So I'll step further, and yeah, and again I'll just touch on this slide. So when we talk, I already told that we have clinics across. So there are few things which we are trying to do. We also have the similar challenges in our clinics and the setups where the crowd management is there, which is a very common problem for everyone. We are taking the advantages of IOMTs and the medical devices and the technology to help us reduce these problems into the multiple ways, into laboratories, into the other systems, which I think my panelists have already spoken on the details. I'm not taking other time. And thank you very much for listening up to us. And thank you very much, sir, for giving this opportunity. Thank you.
Thank you, Amit. You have a good presentation here. There are a lot of IoT devices available in the market. You have to choose anyone which is required for you. That is the one challenging for you. Thank you. Our next speaker is Mr. Sarath. Yeah.
Good afternoon, everyone. Getting the last slot in a presentation means everything is already covered. So everyone knows now about IoT, everyone knows about this different kinds of technologies. I am managing director of Shivam. It's a hospital management software company. So what I'll cover is digitalization in hospital. In morning, I was listening to a panelist. Most of the advancement is already there, wearable, watches, this. But we feel from healthcare industry, the digitalization in the hospital itself is, suppose I get 10,000 patients, are we capable of? Is our digital thing, is our systems, process are in place? So I'm just going to give you 3 case studies in quick time. What is the digital health impact on operations of a hospital? What digitalization can impact on patient care? What digitalization can impact on convenience? I'll start with impact on operations. So, okay, everyone is talking about patient health from morning. So for a change, let's talk about hospitals' health. I feel a healthy hospital can treat patient better. Now, can digitalization solve the following problems? How healthy is my hospital? Can I measure it? What's going wrong in the hospital? Is everything all right? Are my departments performing and are accountable? What surprises am I going to get? CEO and administrators of the hospitals keep firefighting with complaints and distresses because your customers are already patients who are already distressed. So how do we help you? The answer is yes. all of you might be aware of this particular screen. This is ICU monitor, right? Every ICU is having a basic bedside monitor which says, ki, okay, this is the alarm, this is ECG, this is heart rate, blood pressure, this. Without which no ICU patient can be monitored. So what is the beauty of this particular screen is, everything is in one screen. Every monitor, every parameter is in one screen, which is important for that particular patient in ICU. This is what we do. We call it as a control tower, a hospital monitor. If you go to a few of my clients, you will see a TV in each, suppose CEO room will have a TV. Who will go log in and then see whether what is going wrong in the hospital and all? There should be a TV in the room. He walks in, he just sees something red. Now what is that red? Oh, how many discounts are being given? Oh, there is an expiry stock, what my pharmacy head is doing. Something is going to, stock is going to be non-moving. There are dues, there are items purchased, there are open bills, there are this. So, okay, I'm talking mostly about finances. The part 2 of my case study is medical, patient care. So when I'm talking about one particular screen, which is a health monitor of that particular hospital, the administrator's job is just to make sure that is green. Once it is green, there is no surprises you are going to get. And these monitors are not like, okay, I'm the CEO, someone is waiting and it becomes red. It has got 4 levels. It goes to the user, manager, administrator, and then CEO. So there are tats defined, and then only if something is red on CEO's TV means no one has worked below. So this is how this is a monitor system. There is another example of this. This is a personalized thing where, okay, what discharges are going on? Where exactly the delay is? Hangama, where is the hangama going on? Patient, 4 ghanta ho gaya mere ko delay karke, this happened, this happened. This keeps monitoring on where exactly the file is stuck. It follows traffic signal, yellow, red, green. Yellow means under process. Red means gone beyond that, take action. So when below people know the CEO's TV, there is a TV which is going to beep, 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 they know I have to get it done before it goes till CEO. A lot of performance have improved in most of my organizations. So this is one of the example. Okay, does the CEO only has it? Then when we introduce this, then the supply chain head says, then the CIO says, IT head, can I have something like this? So they have their own monitors. The supply chain head have their own detailed parameters. Again, to his level, next level. So what is this digital? This is nothing but your own data I am digitalizing in a monitor style. With this particular concept, okay, you don't need you are out of town, everything is available on your mobile app. With this particular thing, the whole hospital can be monitored. This is the first part. Second part, impact on patient care. I'll just take example of in digitalization, how exactly digitalization can help. All of us are from hospitals, we all know, this is an actual study, 5.2 million medical error occurs annually in India, which is a very high, which leads to very high mortality rate. One of the JCI meetings I was there, they told 40% of deaths in India happens because of medication errors in hospitals. We all know about it, published papers are there. Okay, how do we solve this? The problem is, you can see a TV, IoT. Earlier was again a TV. Just place one TV on a nursing station. What is the problem with nursing station? Every sister has to read do the same job 4 times. Read the case sheet, indent it, think about the medication time schedule and write it, and then take the medicine. And 12 o'clock, right now it is 3:50. 4 o'clock there will be 1:5 ratio. Now I have to go through each case sheet to understand किसी patient का दवाई देना है क्या? Once there are 500 sisters in one hospital, one mistake allowed with so much of complication per month is 500 mistakes per month. Humanly allowed 4 times. So the problem is they don't have one particular sheet telling, okay, boss, 12 o'clock, these are the medicines which are supposed to be administered. These are the vitals which are supposed to be taken. This is our solution. You can see at few of our clients. There, the mortality rate has come down. The medication errors have come down with one single order. I am not asking you to implement EMRs, nothing. HMI-SSR, IP, OP, diagnostics, pharmacy, everything is implemented. No need to touch consultant. DMOs are there. Just place one order. Keep what medicines are supposed to be given. System is capable of dividing it into this particular sort of screen, and it blinks. Sister clicks on it. It blinks exactly on the time. Give the medication. It blinks. Sister says, okay. Even the patient gets a SMS, this medication has been administered to you. You are safe medically, medico-legally, and this. If this is not, if sister has not done the compliance, the first screen which I showed you, it becomes red in the nursing station, nursing superintendent's thing. And she has not acted, within 1 hour, it goes to the CEO. So this is a type of digitalization I'm talking about. Right side, what is this? This is initial assessments has not been completed for these patients who are already received. So when a floor manager is roaming around the floor, all she needs to see is, oh, just with that look of eye, sisters know, oh, there is going to be a round, this has to be blank, there are no tasks supposed to be there. This is power of digitalization. Once you click on that, you can see a blinking screen comes, it tells you the task, at what time it is supposed to be given, they just click on it and done. Just they can do it via their phone also or from computers also, and these are implemented solutions of ours. If this is not done, there is a screens which starts turning red and green, where you can see the nursing objections will be there. All the departments, there will be objections. Impact on convenience. With all this data, what do we have? For example, for doctor, every doctor of our hospital, they have their inpatient list, else they need to go to the reception every day to collect which exactly, where are my patients. So this is floor-wise sorted, so first floor, second floor, third floor, things like this. He clicks on the patient, he gets, lab is already computerized, so the data comes from the lab, X-ray, CT, everything is there. We are capable of, because of this, we have all the CQIs of NABH, we have 200 plus CQIs integrated over here. So this is just a glimpse of how digitalization can help if it is properly used and implemented. These are few of the implementation and installations in and around Delhi. These are our clients. So that's it. So I did well. I'm 2 minutes short. Thank you.
Okay, thank you, Sarath.
Thank you.
This is the one of the example of your smart hospitals. How smart you are. The color code you see it. It is not required to go inside it. The color will tell you that what to do, what action has to be done. Similarly, in the AIMS trauma care also, they have a color codes, the red, blue, green, yellow. So that categories of patients are there, how they can be given the quality of care in the high standards. So if you understand, you have to, frankly, those who are in the hospital, they are working, it is required, the dashboard. It will visualize to you that what kind of services required, what is the responsibility of the people, how they have to react immediately. This is the tools, it will help them out. Thank you once again. Good presentations. And the last presentations, Mr. Ronak, yeah? Yeah, so you will talk about ABDM? Okay, okay, thank you.
Good afternoon, everyone. So I think a lot of our panelists today spoke about IoMT, IoT, digitization, like how do you build infrastructure and things like that. So here I'm here to talk about how does all of this actually kind of bundle down together, or how do you build How do you actually execute? So I think a lot of us in the room might have already heard about Ayushman Bharat Digital Mission, which is an initiative by the government of India to essentially help startups, help everybody come together, be it labs, pharmacies, hospitals, patient apps. How do they communicate with each other? How do they essentially establish that communication with each other? Whereas if there's a new hospital which is trying to come in a tier 2, tier 3 city of India, like rather than them approaching different vendors for different kind of, like if they approach different vendors for different kind of applications, or if they're wanting to build an application of their own, how can they leverage ABDM to be able to achieve their goals? So before we begin, I think like a lot of us today are talking about AI, chat GPT, generative AI, queue management, CDSS. We have all heard of it somewhere, right? But why is it that it is often thought that hospitals are the most resistant to adopt technology changes? Let us try to figure out why. So I think all of us have heard about the prowess of digital India. So India is, like the last 10 years, India has truly gone digital, right? We have 139 crore Aadhaar IDs issued. We have we have Jan Dhan accounts being created. We have 30 crore bill payments happening. UPI, we have crossed 18 lakh crore transactions. We had like 1.1 billion people who were registered and 2.2 billion vaccinations which are also given using CoWIN. So in digital health also, we have observed that like there has been some level of success achieved while both being scalable and frugal. So eSanjeevani has approximately 4 lakh consultations a day, which has 57% women, 12% senior citizens. So we've also built technologies which are inclusive. We have close to 2 lakh providers who are onboarded, 128 specialties being served, and more than 15,000 hubs. So we have truly kind of, with eSanjeevani, we had covered the breadth, we had covered the depth, we had made it inclusive as well. Internet access in India, as some of the panelists earlier spoke about as well, like internet is everywhere. Thanks to Jio and Airtel, everybody in any tier 2, tier 3 city in India or even villages have access to internet now. So what is actually stopping us from going digital, right? So to understand what ails digital health in India, so first is lack of infrastructure and resources. So like one of the panelists spoke about availability of hardware, connectivity, human resources. Then we have lack of interoperability. Everything today is very siloed and fragmented. There's no lack of standardization. While there are some conversations around HL7, FHIR is starting to get adopted, but most of the earlier systems, apart from the Apollos and the Manipals of the world, like if you go to a tier 3 city in India, they wouldn't even understand what a HL7 or a FHIR is, right? So there's severe lack of standardization. There is disinclination for use. A lot of people are comfortable with pen and paper. If you go to any, like if you go to Dharavi in Bombay, people there are, data entry for them is an additional task. There's lack of digital literacy. With telehealth, some of the concerns are that the doctor and the patient are not sitting in front of each other. So it essentially restricts empathy between the doctor and the patient. Then we have, while we have islands of excellence, there is CoWIN, Arogya Setu, PMJY, which are working in silos. Few hospital chains which are also doing good work, but they're not speaking to each other. And then lastly comes privacy and security concerns, which is legal provisions. They're difficult to implement. There's lack of awareness as well. So in short, there is not much adoption of digital health as of now. So just building on top of the last speaker, what does digitalization for a hospital mean, right? So there is discoverability, there is appointment booking, there is teleconsultation, there are aspects of inventory management, there are integrated labs and pharmacy, which Mr. Meher also spoke about, of how do the labs and pharmacies in a hospital talk to each other. There are regulatory compliances, there are HR admin functions to be managed. On the patient side, there are PHR applications, EMR for doctors, data storage has to be managed, money has to be managed via claims. There are invoices which have to be managed. Hospitals need to also start communicating with their patients so that care post-hospital also given. So there is a lot of things which have to be in place for true digitization for a hospital to actually happen, right? So the question to answer here is, will ABDM be able to help achieving digitization, or maybe the next step is making it smart? We'll try and understand ABDM in a bit more detail. So there are 4 pillars of Ayushman Bharat primarily. First is PM Ayushman Bharat Health Infrastructure Mission, which is to build infrastructure and strengthen the existing institutions. AIIMS is already doing a lot of pioneering work in that regard. There are Ayushman Health and Wellness Centers, These are health and wellness centers which are being established in the district centers to deliver primary care closer to home. There is Ayushman Bharat Digital Mission. Ayushman Bharat Digital Mission is more about building that backbone infrastructure to deliver and support delivering healthcare, digital health in the country. And there is Pradhan Mantri Jan Arogya Yojana. You would have heard Modi ji going and distributing cards everywhere. So this is essentially the health insurance which is given to more than 10 CR families today. And more than 4.8 CR people have already benefited so far. So when it comes to interoperability with ABDM, what ABDM allows is different applications to talk to each other. So if there are private hospitals, general practitioners, labs, ASHA workers who are collecting data on the ground, there are government health programs. One of the concerns that a lot of government health, lot of ASHA workers have is every ministry, like every department in the health ministry launches their own program. So data doesn't even talk to each other. They have to fill the same application again and again across multiple systems, right? Because each of them are running their own KRAs. So there is that. There are health applications and lockers, and there are multiple other applications as well. So what ABDM does is it gives you essentially a plug. All of these systems have to plug into that ecosystem so that they're able to talk to each other and data can be shared across these systems in a seamless manner. So from a citizen's perspective, ABDM allows them to have better control on their medical records, discover, access and avail health services and products, and digital records save time. From a healthcare provider's perspective, it helps them in better decision making. Like IoT kind of devices, AI kind of tools will help them make better decisions, promotes use of teleconsultations, allows them to manage their records better, and also helps in faster and cost-effective settlements of claims. For policymakers, it allows them to see, view and analyze public health data at a national level, and also implement policies at a local level more effectively. So these are the 4 core registries of ABDM. So first is every patient. So if we talk about the key stakeholders, there is patient, there is healthcare professional, there are like facilities, and then there are drug registries and things like that. So first is ABHA, which is a universal identifier for a patient. HPR is a universal identifier for healthcare professional. It could be a doctor, nurse, ASHA worker, anybody. HFR is a universal ID for a health facility, which is any lab, a pharmacy, and all of them will essentially start having healthcare facilities. The architecture which ABDM follows is more federated, where the data exchange is happening via the central switch, similar to how UPI allows us to communicate from one bank application to the other, from one application to the other, from one bank account to the other. Similarly, with HICM, which is consent management, with patient's consent, a facility can essentially link a record, and with patient's consent, another facility can essentially access the record. A patient, while also trying to access the data, will implicitly give a consent which allows them to access that record as well. So there is no central repository for any health record. The data stays at the source where the data was generated. So there is privacy and security at its core. It allows more health facilities to participate. It has been designed to work with and without mobile phones. It is aligned with the data protection laws, and it's more of an ecosystem approach where the data sharing is happening with consent and for the duration that the data consent was essentially given for. So this is an overview of how, so anybody who's essentially generating a data is a health information provider, and anybody who's using the health information is a health information user, and the exchange happens via the consent manager which sits in between. So one more concept around ABDM is unified health interface. So today if I have to book a lab test for LalPath lab, I have to essentially go to the LalPath lab and book a test. So what UHI enables is any application which is connected to the gateway should be, any health facility should be discoverable. I should be able to book an appointment from Arogya Setu to AIMS or CMC Vellore. Similarly, I should be able to use Arogya Setu to book an appointment, to book a lab test with LalPath lab or 1mg as well. So it allows for like interoperability of services as well, similar to what ONDC is trying to do. So some of the services enabled by UHI are digital consultation, physical consultation, ambulance services, and lab diagnostic services. Digital consultation and physical consultation are already live, the others are work in progress. So ABHA essentially is more of, so this is how the government programs come together, where any person has an ABHA ID, like across whatever programs they are being catered to, RCH, IDSP, Ayush, Covin, or private hospital data, a longitudinal health record for that patient is essentially getting created. All of this data is also primarily anonymized and can be aggregated at a data policy level for more analysis to be done and for services to be delivered effectively. So impact of ABDM, it essentially leads to cost efficiencies. There can be more market expansion. OPD insurance coverage can be there. Increased patient compliance to treatment can be there. Home-based care can also be extended. So, there are multiple opportunities which exist once you build on top of ABDM. So these are the different stakeholders within ABDM. There are citizens, there are the government, there are health tech companies, insurance providers, pharma industry, non-profit organizations, healthcare providers. So each of them have to be uniquely engaged for ABDM adoption to happen. Yeah. So just to recap, how does ABDM help a hospital become smart? So there is UHI or scan and share, which is already functional in names, which allows discoverability, appointment booking, teleconsultation, and integrated labs and pharmacy. There are M1 to M3 integration, which is more around for PHR apps, EMR for doctors, data storage, and regulatory compliance. Health claims exchange helps in management of claims and booking. Yeah, and then there are smart hospitals, which could include more of AI for smart diagnosis, fast patient registration, summarize patient history for diagnosis, claims, and providing care at home. Yeah, so that is what. Thank you.
Thank you, Ronak. It is a unique achievement by the Government of India. May I know how many of you have the ABHA ID? Raise up your hands. It is not even 10%. So the one facility is come up by the Government of India, and you are the well-educated people. Why you do not have this one? It is free of cost. We supposed to have. If you use the ABHA ID, see what it happens. Today, you are sick, you are going to hospitals, and you are doing all the tests and all the information is in your hand. After 2 years or 6 months, you lost. But you can retrieve that one if you have the connected with the ABHA ID. This is one of the plus point for you. So, it is my request, all of you should supposed to have a ABHA ID yourself. Okay. Thank you. Any questions from the audience? Right.
Sir, we are running a little late. Okay. So we'll take the questions and we are also having the tea break at 5 because we're really running short.
Okay.
So I have one question for the Ayushman. This thing. Still a lot of rural hospitals are facing problem to register to you. Okay? Because either they have to use an agent to fill up the forms. So you need to look into a Saral form where the hospitals can get into it and the people of that village can benefit out of Ayushman. Still a lot of population, the people not been getting the Ayushman facility because the hospitals have not been registered with Ayushman and the administrators of the hospital is facing a lot of problem. So this is something feedback which I got it, I thought I'll share it with you. You need to make it a little Saral, like IT, income tax, we have a Saral form. You should also make it a Saral form where the questions asked less. You know, otherwise a 50-bedded hospital or a 75-bedded hospital and the nearby people are not being getting a good health because they can't have the Ayushman facilities. I'm sure some of you are facing this problem, right? Yes? How many of you facing this problem? See, 1, 2, 3, 4, 5, see? They all are not registered with Ayushman. So you need to look into this. This is something
So I
feedback.
think the team is already looking into it. I could not cover that slide because of technical glitch, but like right now we are working with hospitals to simplify the entire integration process as well. Initially, when we were integrating, when as a part of Bajaj Health, the integration used to take like 8-9 months. Now we have got it down to like less than
So
a week.
those who have not registered, they have a stall behind. You can go and check. The National Health, they have a stall here. Please go and give your name of the hospitals and all, and be in touch with them to get registered.
Sure, sure. Any questions, feel free to reach out at the stall.
Thank you. So thank you, ladies and gentlemen. May I request Dr. Sushil Kumar Meher to present the mementos. First to Dr. Amitabh Yadwanshi, the coordinator of the cardiology head of Holy Family Hospital. So aims to Holy Family. Then to Prashant, who gives the digital, make it hospital more digital and secure. Dr. Amit Swarup, head business from Stemz. So any healthcare, any lab you want to set up, please approach the Stemz. Sharad Anand, for any hospital information systems, as he's put blue, white, red. And we all appreciate that red color which comes into these things. Dr. Ronak, now you will have a good crowd in your stall because they have to be registered now. So make sure all they are registered. Huh? Before you leave, make sure all of them are registered. Okay. Thank you so much. I request Dr. P.N. Singh to please come on the stage to present a memento to Dr. Sushil Kumar Meher. He is going to be the chairman for the next session. So let me start giving him work from now so that he is prepared for it. Thank you, thank you, thank you so much. We'll have the next session now. We'll move to the next session immediately. Please put up the names.